Question 51, what is the most likely diagnosis? And it is all ortho, MSK. An 8-year-old boy is brought to the clinic for right hip pain and limping for 3 weeks. He denies trauma or fever. This presentation, by the way, is just very classic. They love asking these sorts of questions. His parents say he tires easily and limps more after activity. On exam, internal rotation and abduction of the right hip are limited. That's important. There's no joint warmth or erythema. The labs are also very, very important when you're working through these types of questions. You want to make sure it's not a septic arthritis, rheumatoid arthritis, gout. So labs, pay attention to those. White cells, ESR, and CRP are all within normal range. So this tells us it's not an inflammatory process. White blood cells probably tells us it's not an infectious process. So right away, I'm going to cross off septic arthritis, and probably JIA as well. That tends to be an autoimmune and chronic inflammatory condition. Okay, so we're limited between transient synovitis, LCP, and SCFE. These are all fairly similar conditions, but there is some minutia that we do need to be aware of. So transient synovitis tends to be due to a viral infection. So typically this is a post-viral syndrome that quickly resolves, hence the term transient, goes away on its own. LCP and SCFE are very commonly confused. I'm going to make it make sense so you never mix them up ever again. You've classically seen that one of these conditions is in younger patients and the other is in slightly older patients. It's all between single-digit ages and early teenage years though. So let's make it make sense. LCP is due to a vascular cause of avascular necrosis. So for some reason, the femoral head stops receiving adequate blood flow and it dies. In SCFE, it's a mechanical cause of AVN. So something physically disrupts the femoral neck. The femoral neck has the medial femoral circumflex artery, which supplies the femoral head. And so if that neck is disrupted, you also disrupt the blood flow to the head. So that's where the mechanical AVN comes from here. Now, just think about it this way. If you have a younger patient, younger patients tend to be lighter. So why would there be a mechanical cause, a mechanical disruption of the femoral head in someone who's light? In older patients, they tend to be heavier. So that's why you tend to get these mechanical AVNs with SCFE. And so you'll also notice that you can have high BMI in both, right? It could just be to throw you off. But classically, SCFE has higher BMI. So just think older equals heavier, which equals mechanical AVN. Mechanical is your SCFE. It just breaks, the femoral head just breaks straight off the femoral neck. If you have a younger patient who's lighter, though sometimes they can have high BMI too, just think younger, supposed to mean lighter, therefore vascular cause. There's no mechanical disruption. So it's LCP. All right. And this guy is 8 years old. So he's young. He's not in the young teenage years yet. So I'm assuming he's pretty light. They don't give us his BMI. I'm going to assume he's light. Therefore, he's young. He's light. It's probably a vascular AVN from LCP. So the correct answer is C.